as always, hear the end of the newscast and then some silence, and then we'll be on the air.
Blue Shift proposed a small bore rocket launch site on an island off the mainland. Blue Shift's chief executive, Sasha Derry, says he supports the moratorium, but hopes he and Blue Shift and the town can come to terms before the 6 months are up. Precipitation will wind down as rain most places today. Look for high temperatures in the 30s and 40s.
Welcome to Maine Calling. I'm Jennifer Rooks. We had all hoped to see a turn for the better in the pandemic by now, but that is not the case in Maine. Today, to get the very latest on the numbers and the reasons behind them and what might be next, Dr. Nirav Shah returns to Maine Calling. He is the director, of course, of Maine Center for Disease Control and Prevention, and he is ready to take your questions. You can send an email, a brief email, to talk@mainepublic.org, or you can post a comment or question on Facebook, Twitter, or Instagram, or give us a call, 1-800-399-3566. Please note today's program is also being live streamed. You can view it on Maine Public's YouTube channel or on Maine Calling's Facebook page. Dr. Shah, welcome back to the program. And as always, I think we'll just start by what is the very latest information that is coming into your office?
Well, good day, everyone. And thank you, as always, Jennifer, for having me back on. It's an honor to be able to chat with everyone about where we stand. And, where we are today, it's one of these interesting situations where, in many respects, the pandemic has never been worse. And I can talk about why, even notwithstanding some of the highest vaccination rates in the country, the pandemic continues to excise a major toll on Maine people. But at the same time, things are also looking up in terms of vaccinations, vaccination rates, booster rates. All of those metrics are simultaneously getting better. It's difficult to reconcile those two things. And I acknowledge that. Our team spends a lot of time trying to peel back the layers of the onion to try to understand where we are. Right now, here's the bottom line. The pandemic is at its peak right now, or at least the highest it's ever been in Maine. We all fear the possibility that it will get worse. Based on the trajectory that we've seen with case growth, hospitalization growth, positivity rate, as well as other transmission factors in Maine, we anticipate that in the next several days, if not the next few weeks, the situation in Maine will continue to get worse. I expect that over the next 24 to 72 hours, we'll see even more cases that are reported. We'll see continuing high levels of hospitalization, all of which puts a very real strain on people, their families, to say nothing of healthcare workers. If you have not yet been vaccinated at this point, the one question I want to ask is what's holding you back? If you have been vaccinated today, this week, this weekend, it's time to go get a booster.
Some people might say, Dr. Shah, I've tried to get a booster. I've made a phone call. I've tried to make an appointment. I have an appointment for 2 weeks, 3 weeks from now. It's frustrating to me.
It's extremely frustrating. And it's been disappointing to me. It's more than frustrating. It's outright disappointing. Right after Thanksgiving, I started seeing emails and social media posts of folks whose appointments for boosters were getting canceled at various pharmacies across the state. And that piqued my interest, but I wasn't sure if it was transitory, perhaps because of staffing challenges with the holiday weekend. But by the next week, by 1 week ago, those complaints had persisted and grown even louder. Late last week, my team and I, working with the Maine Emergency Management Agency and the Maine National Guard, after having verified a number of these complaints, started planning to expand the availability of boosters in direct response to the concerns and complaints that we heard from people across Maine. For a number of reasons, we chose a site here in Augusta at the Armory. It's a site that we have a relationship with. It's proximate to the Maine CDC, And as we mapped out where the complaints were coming in from, we saw that they were largely in points north of Lewiston, from the mid-coast upward, and then further north beyond Waterville. Areas of the state where if your appointment gets canceled at your local pharmacy, there's often not an alternative. That's why on Tuesday, we opened up a large-scale site at the Armory here in Augusta. It was open on Tuesday, it was open yesterday. It's going to be open today from noon until 7 p.m. And we can administer 7, 8, 900, up to 1,000 shots a day. Indeed, we did 723 shots yesterday. You don't need an appointment. We're offering all 3 vaccines, and anyone who's eligible for a COVID vaccine. That is to say, everyone 5 years and over is free to come. There's no charge to you. You don't need any type of appointment. Just walk in and you can get any type of shot, first dose, second dose, booster. And again, all of this is being done in response to Maine people raising their hand and saying, the system's not working. What I said on the radio last week was, if the pharmacies can't get it done, then the Maine CDC and our partners will.
Dr. Shah, I'm listening to this right now and I'm thinking, oh boy, I would love to hop in my car and drive straight to that clinic right now and get a vaccination, but I can't. Maybe I have to pick up the kids at school. Maybe I have to work this evening. Last I saw, this is not open tomorrow, but is Saturday 9 to 4. Is that still the plan?
That is the plan, Jennifer. Yes, not every day works for every person, but we'll be there tonight until 7 p.m., but also on Saturday from 9 a.m. to 4 p.m. I'll be there. We'll be volunteering there all day. Our dog Quincy will be with us. So if today doesn't work, Saturday we'll be there from 9 to 4. We'll be there next week too. Tuesday, all throughout the day, as well as next Thursday from noon until 7 p.m. Then as we get closer into the month, closer to other holidays, we're looking to see which days will work for the most number of people. We intend to operate this site at least through the end of the month, hopefully early into January, so that folks who show up and got their first dose there, maybe you brought your 6-year-old, as I met a family that did yesterday, we want to make sure that they can get their first dose and their second dose with as little of a hassle as possible.
Yesterday, Governor Mills announced the National Guard is being deployed. I believe 75 members of the Maine National Guard being deployed to help out Maine hospitals. Can you explain how that will work? How can the National Guard help Maine hospitals better respond to this surge in hospitalizations right now because of the COVID-19 post-Thanksgiving surge in hospitalizations?
Certainly. One corollary of the increase in cases that we're seeing is an increase in hospitalizations, an unprecedented increase in hospitalizations. Indeed, today we hit another new sad high mark in terms of the number of people in Maine hospitals in the intensive care unit. All of that pressure puts a strain on the healthcare system overall. Now, there are 2 types of ways to provide healthcare. There are 2 things that are necessary to provide healthcare. One is direct patient care. That's what a physician, a nurse, a physician assistant, a CNA does by taking your blood pressure, by administering medications, all of the things that we often think of when we think of healthcare. But there's another part that's just as important in healthcare. It's all the wraparound services. It's taking out the trash in the room. It's making sure that patients can go from their room to X-ray really safely. It's making sure food gets delivered. Right now, a lot of healthcare staff are doing those nominally non-healthcare tasks. Our approach is to utilize members of the National Guard who, even though they are not clinically trained, can be brought up to speed on the processes of hospitals. If an RN at a hospital doesn't have to take out the trash, he or she can focus on providing that direct patient care. Rather, those environmental services, food services, patient transport, that's what we can utilize the National Guard to assist and fill in, thereby freeing up healthcare staff to make sure they're doing more direct patient care. Now, Jennifer, this is an advance for us. It's another step in our use of the National Guard. But I think it's important for folks to know the National Guard has been by our side throughout the pandemic. This is a further use of the National Guard more directly to healthcare facilities. But folks may remember even last summer and spring, the National Guard was out there doing fit testing. They've always been out there delivering PPE and vaccines. They've been assisting facilities when they were in extremis. Now we're broadening that ambit. We're so pleased and thankful for the men and women of the National Guard, for their service and for their partnership.
Dr. Shah, so much coverage of this new variant, the Omicron variant, some people calling it the Omicron variant. Wondering, do we know for sure if it is in Maine? What is the very latest on that?
Here's the bottom line there, Jennifer. This variant seems to spread very quickly based on reports and data that have come out of South Africa, as well as some other early reports in other countries around the world. It's been detected as close as Connecticut and Massachusetts here in New England. And so it is extremely likely, if not certain, that it's already here in Maine. We just haven't detected it yet. Now, we do a lot of so-called genomic sequencing here in Maine. We look at the DNA or the, in this case, RNA fingerprint to try to see if every positive sample matches the family tree of Omicron. It's likely only a matter of time before we detect it here, but it's probably already here in Maine. Here's what we know about it. It seems to spread from person to person much more easily than even the Delta variant. It's unclear at this time whether it makes every individual who gets it any more sick than they would have been with the Delta or a prior variant. And there are some early signs that individuals who have gotten their booster, not just their first 2 shots, but their booster, can enjoy a high level of protection against either getting sick or landing in the hospital. But we need more data on some of those latter questions before we can really say for sure. I think it's safe to say that a lot of us woke up over at some point the Thanksgiving weekend to the Omicron variant being in the news. And I don't know about a lot of you, but it raised my blood pressure and it gave me a little bit of heartburn, if not a lot of heartburn. The news that we've seen in the last 3 or 4 days has been reassuring, but we're not out of the woods yet. Anything that can spread more easily, even if it causes the same percentage of hospitalizations, can still lead to more people being in the hospital just because of how much more easily it can spread.
Dr. Shah, I'm going to go to Susan, who's calling from Augusta. And starting with Susan, I think you have a question that many other people have as well. Go ahead.
Given the ongoing loss of lives and incredible suffering in our community, what is the justification for not requiring masks like other states have done?
Sure, Susan. There have been a couple of states recently that have or have had a mask mandate in place. Some have expired, like in the District of Columbia. And there are, I think now, maybe 4 states that still have a mask mandate in place in indoor public settings. And I think there are a few reasons why at this time it's not our top priority. But let me start by distinguishing between wearing a mask and a mask mandate. Wearing a mask is critical. I cannot stress enough the importance of wearing a mask anytime you are in an indoor public setting. We do it here at the Maine CDC. Anytime we're in a meeting that's outside of our office with other people, folks are wearing masks. Even though for the most part, we're a public health agency, folks are vaccinated here, we still wear masks. I strongly urge everyone who's listening to do the same thing. That's masks. But the question you ask, Susan, is about mask mandates, which is a different thing. A mandate, as we all remember from last summer, is a legal imposition. It requires the governor to restate the state of emergency. It requires enforcement. It requires clear boundaries as to where it applies and where it doesn't apply. It also presupposes that indoor public settings are a large generator of transmission of new cases. Our data don't exactly bear that out. Our data suggests that the bulk of transmission is not happening at Walmart or Hannaford's, but rather in private indoor gatherings, something that would be beyond the ken of a mask mandate. So as we think about tools that are available to government right now, we've got a limited bandwidth, right? I spend an hour a week talking with folks in Maine out of the hundreds of hours that folks have, spend an hour a month on Maine calling. We have a limited amount of time with which to talk to folks about what's going on in Maine and ask them what is the most important. In that limited bandwidth, the question that we have to face is, what is the highest value thing out there right now? And for my money, the highest value thing out there right now, in terms of what government can and should be doing, is making vaccines as easily available as possible. Does that mean for a second that I want to downplay the importance of masks? Zero, not even close. Once again, everyone, vaccinated or not, should be wearing a mask in an indoor public setting in all 16 of Maine counties. But when it comes to a mandate, I don't think that we're there yet based on where things stand today. But That's why. That's why we are where we are. It's not that I'm averse to masks. It's just that when it comes to mandates, we have to be careful.
Susan, thank you for the question. And many people are emailing in a similar question. An email here from Zach, also some variety of this is a common question coming in. Although vaccines are probably the most important tool for fighting the pandemic, we see that with breakthrough cases, vaccines are not perfect. The only really safe way to socialize in person is to get a PCR test. Access to convenient and accurate PCR tests are so important that state and municipal governments all over the world, including New Hampshire, have made them free and available on a walk-up or drive-in basis. Unfortunately, PCR tests are really hard to get in Maine. Why can't our government provide PCR and vaccinations to the people of Maine?
Sure. Well, so the first answer there is that we are. We have a number of swab and send sites across the state, from southern Maine all the way out to Calais, where PCR tests are free and available to any single person who walks up and wants one. So testing is out there. Indeed, as of yesterday, the testing volumes in Maine were among the highest that we've seen throughout the pandemic. But one important note there, PCR testing is not actually the best use case for the situation that you described, Zach. For what you're looking for, antigen testing is indeed preferable. Now, breakthrough cases have been happening. One of the better ways to reduce the likelihood of getting a breakthrough case is by getting boosted, which greatly lowers the risk of a breakthrough case, as well as the complications that can occur after a breakthrough case. But I agree that making sure you are socializing in a safe manner as we go into the holidays is much more easily accessible if you've done an antigen test beforehand, not necessarily a PCR test. Antigen tests, although nationally, there have been challenges in obtaining them. They are available. I actually ordered 6 of them last night online, and I'm told they're going to be arriving today. So they are available, and that's the test I would use were I about to go socialize with a group of folks as we get into the holidays. PCR testing remains available at our swab and send sites across the state, however.
All right. Well, I'm going to ask you a similar question. This is from Jean. I have been trying to buy at-home rapid tests when I can find them, and I hope to have about 6 at hand to use over the holidays. So same as you, Dr. Shah, she's hoping to have 6. I'm in my 70s, live alone, and am fully vaccinated and boosted. I will be singing in a holiday concert this weekend and gathering in small groups with family and friends on several days during the holidays. What is the most effective way for me to make use of my limited supply of test kits? So
Great
what's
question.
your advice for Jean? How does she use them?
That's a great question, Jean. What I recommend doing with those tests, first of all, kudos to you for ordering them. And I was able to find some on the website of a very large retailer based in Arkansas. And they will be delivered quite soon, from what I'm told. The best way to utilize them is right before you go into an event to use one. Now, this can be right before you hop in your car to go to the choir practice, or before you gather with that small group of friends. The key, though, is to see if the others with whom you will be gathering, Jean, can do the same thing. If you could urge your friends who you'll be getting together with to similarly try to get their hands on tests and use them before you get together for dinner or for whatever you're going to be meeting to talk about and hang out to do. If everyone who is gathering is fully vaccinated, fully boosted, and has gone that extra mile to take a rapid antigen test right before they show up, that is about the lowest risk gathering that we can envision for this time of year.
Well, we're going to take a quick break. We are speaking with Dr. Nirav Shah of the Maine CDC. When we come back, more of your comments and questions. This is Maine Calling. We'll be right back.
Listener support brings us Maine Calling, with help from Bull Moose, celebrating the tactile experience of reading and proponents of dog ears and bookmarks. Learn more at bullmoose.com. And Evergreen Home Performance, dedicated to helping homeowners qualify for Efficiency Maine installation rebates and loans. More at evergreenyourhome.com.
For business owners across Maine, Maine Public's audience is your audience.
My name is Tony Jambro. I'm the owner of Paris Auto Barn in South Paris, Maine. We're an automotive repair center and used car dealership that specializes in hybrid and electric vehicles. We feel that Maine Public's well-informed and ecologically minded audience fits perfectly with our target audience. Maine Public has helped us in so many ways.
Visit us at mainepublic.org to get started.
The Maine Public Classical Holiday Stream offers a wonderful selection of seasonal music to help get you in the mood or provide a much needed respite in your December day. This locally curated collection includes a wide variety of well-known selections, along with new classics and some fun surprises along the way. The Maine Public Classical Holiday Stream is available now at mainepublic.org. It's one of 4 live audio streams available, or on the Maine Public app. Enjoy.
Welcome back. This is Maine Calling. I'm Jennifer Rooks, and today on the program, Dr. Nirav Shah, Maine CDC Director, and he's going to give us the latest updates on vaccinations, variants, testing, and more. You can send a brief email to talk@mainepublic.org, tweet at Maine Calling, find us on Facebook or Instagram, or you can try to get through 1-800-399-3566. And also you can view today's conversation with Dr. Shah, the live stream available on our Maine Calling's Facebook page or Maine Public's YouTube channel. So many questions coming in. Going to try to get to as many as possible. Kelly on Instagram writes, Walgreens canceled my relative's second dose today because they have no Pfizer vaccine in the Bath Brunswick area. What is being done to get more supply of the vaccine to Walgreens?
Thanks for that question. This has been, again, more than disappointing to me. As soon as I started hearing that vaccine appointments were being canceled, after verifying some of those, I sent an email to the leadership at Walgreens as well as other chains and said, people in Maine are being told that there's not enough supply at your stores. And if you need supply, you let me know because my team can get it to you for your stores that day if need be. And what I heard back consistently was it's not a supply concern on our end, it's a staffing concern. To which my response was, understood, staffing is a challenge, but then make sure your stores aren't misleading people in Maine by telling them it's a vaccine supply, because we literally have an entire freezer full of vaccine that we can deploy. Indeed, that's where I'm getting the supply to operate the clinic at the Augusta Armory. Vaccine supply is not the challenge right now. So we would be delighted if partners across the state were to call us and say, we'd like to increase our hours. We'd like to honor and reschedule the appointments we had to cancel. Can you help us out with vaccine? The answer would be an unequivocal yes. But thus far, what appears to be the case is that the main concern on their end, the roadblock, the impediment is on staffing. But let me be very clear. Maine CDC is standing by to deliver vaccine. Any pharmacy, indeed any provider who needs it, if they can turn that vaccine into a vaccination.
An email from Melinda. Can I get the booster a week after I get the flu shot?
Yes, you can get the booster a week after you get the flu shot. You can get your booster the same time you get your flu shot. You can get it before you get your flu shot. You should get it at whatever schedule makes it as easy as possible for you to do both as soon as you can.
We'll go to Brian, who's calling from Southwest Harbor. Hi, Brian. Go ahead.
Well, my question is, following the outbreak of the different variants, is it possible for a person to be infected with both the Delta variant as well as the Omicron variant, or does one supersede the other?
Brian, that's a great question, and I don't know the answer to it. It seems theoretically possible that someone could be exposed to both, given how in many parts of the globe and probably in the United States, both variants are circulating with equal force. And given how contagious both of them are relative to other infectious diseases, you could easily not just be exposed, but also ingest enough of the virus such that it might cause disease. But your question is an interesting one. What happens then? Do they slug it out in the body for superiority? Or do they cause a super illness or super infection? I have not heard of any reports that have assessed that. It's possible, but here's the good news though, sir. The vaccines that we've got, based on very early data, continue to show strong efficacy, particularly when there's a booster involved. Is it the same? Is it the same as what it might have been a year ago? No, but it's still quite strong. There has been a little bit of a diminution in impact. The full extent of that will still be under review and study, but having your vaccine plus your booster definitely does not take us back to square one. It still protects you to a large extent, and that's very good news.
Brian, thanks for your question. An email here from Mary. Do you have any information about how the AstraZeneca monoclonal treatment for immunocompromised people approved today will be distributed in Maine? How would one get qualified for this?
It's a great question, and Mary's on it. As Mary notes, just yesterday, the US FDA granted an emergency use authorization for a very exciting product that AstraZeneca has developed. It's a long-acting monoclonal antibody that is intended to be used before somebody is exposed to COVID, what is known as pre-exposure prophylaxis. It's designed and intended to be used in individuals who are immune compromised or for whom a vaccine is not expected to work as well. Unfortunately, at its initial run, the United States will only be able to have 50,000 doses. That's for the entire country. For the entire month of December, Maine is only expected to receive at most about 400 or so doses. Given the population in which this drug will be the most effective, that is to say those who are immune compromised because of a recent organ transplant or because they are actively being treated for cancer, we're working with the providers who see those patients on a regular basis as their medical home, whether it's the large hospitals or New England cancer treatment specialists, groups of that sort, to position the drug there, because they'll be in a position to understand which patients among those whom they care for will be the most able to benefit from this drug.
An email here from Megan. Please let me know when my 16-year-old can get boosted.
It's on its way. Right now, boosters are authorized only for those who are 18 and over. But of course, that leaves out a lot of folks who have already gotten their primary vaccines, 12 to 17-year-olds specifically. Pfizer in particular has applied to the US FDA to extend the purview of their authorization to include initially 16 and 17-year-olds for boosters. I'm not sure when the FDA will act on that, but I'm told that it's a priority, and then I'm also told that it will be soon. I don't know if soon means months or weeks, but I think it's going to be on the more on the order of weeks.
All right, another email here from Dawn. Given the high vaccination rate in Maine and the daily high rates of new infections, will the virus at some point run out of people to infect?
Yes, Don. That is a sad and morose reality, but yes. One of the ways that outbreaks end, which is an area of study unto itself. How do outbreaks end? But in general, outbreaks end when the virus or bacteria runs out of susceptible people to infect. Effectively, it encounters a population where everyone is either immune or sadly passed away. They're immune either because they got the virus or bacteria or because they got a vaccine. If you ask me, given the risks inherent in getting COVID, the much safer route at this point is to get the vaccine.
We'll go to Karen, who is calling from Waterville. Hi, Karen. Go ahead.
Hi, thank you both for what you do. I'll be brief. Are you still recommending that people change it up when they get the booster and get a different maker, or is it good now to stick with what you've already had? If you've had Pfizer, for instance, should you try and get the same brand as a booster?
Karen, I've been over at our vaccination site here, the one that we stood up at the Armory here in Augusta, and I've been there every day that we've been open. And Karen, that is by far the number one question that folks have asked me. And here's what I've told folks. You can't go wrong. You cannot make a wrong decision here. There are some data that suggest that mixing and matching is a really good strategy. There are also some data that suggest with, maybe not data, but if you had a good experience with your first set of vaccines and you want to stick with that for your booster dose, that is A-OK too. I will tell you that in my own personal case, I stuck with the same manufacturer as my first 2 shots, as did my mother, as did my spouse. But you may want to mix and match, and there is nothing wrong with that. I don't have a firm recommendation one way or the other. What's more important to me is that you get a booster rather than which one you get.
Karen, thanks for your call. We're going to move to Rockport and Sarah. Hi, Sarah. Go ahead.
Hi, I was calling with actually 2 questions. One, I was wondering if there's ever going to be a school and daycare mandate for staff to be vaccinated, which I would really appreciate. And I was also wondering, reading about all the hospitalizations right now and how it's taking away from the care of other people, if there's going to be any way to prioritize or deprioritize people who aren't vaccinated, because it really makes me angry that the hospitals are being overrun with people that could prevent this.
I totally hear that. Let me start with your latter question, because this has come up and I've seen it in various different social media, because it comes from a place of frustration, particularly frustration among those who are vaccinated, who are boosted, who are out there wearing masks in public settings, folks who have abided the best recommendations of public health officials across the country. And they look around and they now see schools having to shut down because they don't have enough staff, or they see hospitals being chock full and wondering if their loved one had a heart attack or a car accident, whether there would be an ICU bed for them. And I think in those situations, it's easy to see where the impetus, where the notion that we should deprioritize or de-triage individuals who aren't vaccinated. I get that instinct, but I caution us against going down that road. It's a dangerous road to go down. What we want of medical providers is such that when you walk in the doors, it doesn't matter how you got there. The choices that you made or didn't make on your road to the ER don't matter once you walk in the door. That is, I think, for all of us, the right road to get into. Otherwise, we get into a world where, does that cancer patient with lung cancer really need care given that they smoked? Does that person who had a snowmobile accident really need care? Isn't that a dangerous activity? The last thing we want of our healthcare system is to be second guessing our life choices. We need to know that when the chips are down, the healthcare system will treat everyone equally. So I'm not on board with that, even though I understand where the instinct comes from. I think it's a dangerous one. In terms of what we can do to help schools and daycare centers, we're discussing other options. Right now, we're not moving in the direction of the requirements that you suggested, but that's partly because we're focused on getting folks who voluntarily want to get vaccinated. That's what we're focused on right now. It's important to note that many of those individuals, say school officials, will be under the Biden administration's requirement under OSHA that they be vaccinated insofar as they are part of an employer that's 100 employees or more. A lot of that is working its way through the courts right now, but that will be part of the way that, say, school officials, teachers, staff may eventually be needed to get vaccinated.
Sarah, go ahead. We have a related question. Thank you for yours. And this is from Chelsea. My daughter is 1.5 years old and attends a daycare where staff do not wear masks, nor are they willing to discuss vaccination status. As a pandemic parent, this concerns me greatly, especially since COVID has started going around the daycare. Yet, of course, I have no choice but to send my daughter there every day. I was hoping you could speak to what the rules are for daycares in Maine. Do daycare staff really not need to wear masks? Is there anything I can do to protect my young daughter?
Well, in terms of the setup there and the rules, daycare staff, let me start with where we should be. Daycare staff should absolutely be wearing a mask. There is this older notion from the before times, early in COVID, that kids were spared or not as affected by COVID. And as we've seen with more transmissible variants like Delta, to say nothing of Omicron, which is on its way here, kids can absolutely be affected. Yesterday, for example, there were the highest number of kids that we are aware of in the hospital in Maine with COVID-19 than at any point in the pandemic. So I think your concern is well-founded. In terms of the way to approach this, it's unfortunate that the daycare is not willing to entertain discussions. Even more unfortunate that you don't have alternatives. It is a challenging situation. I don't want to downplay that. Were I in your shoes, I would keep it up and potentially see if other parents would be willing to join up with you to have a frank conversation about at least making sure that daycare staff are wearing masks.
We are going to take another quick break. When we come back, more of your questions for Dr. Nirav Shah, head of the Maine CDC. We'll be right back.
Listener support brings us Maine Calling, with help from Eastern Basements, a division of Maine-owned Eastern Mold Remediation, offering cross-base repairs and waterproofing. EasternBasements.com, and the Freeman Ellis Family Fund, supporting Maine Public Radio, local, national, and international news you can trust.
I'm Scott Tong. President Biden's big infrastructure law will likely change how cars are made, from more protective hoods and bumpers, to better headlights, to technology that may prevent you from driving drunk. And your next car may tell you when you've accidentally left a kid or a pet in the back seat. That's next time on Here and Now.
Join us for Here and Now today at noon. Maine Public is pleased to be a media sponsor of the Ralston String Quartet in Concert, presented by Collins Center for the Arts in Orono. Join the Ralston String Quartet as they perform pieces by Haydn, Shostakovich, and more live on Sunday afternoon, December 19th. Maine Public members are eligible for 15% off tickets to the performance. For details on the concert and the Maine Public member discount, please visit mainepublic.org and click on events.
Welcome back. I'm Jennifer Rooks. You are listening to Maine Calling. Here with me, Maine CDC Director Nirav Shah, with information and advice about your public health questions, predominantly, of course, about the pandemic. You can call 1-800-399-3566. Send a brief email to talk@mainepublic.org. Post a comment or question to Twitter, Instagram, or Facebook. And yes, this is being live streamed. You can find it on Maine Calling's Facebook page or Maine Public's YouTube channel. Dr. Shah, I'll ask you a question that's not about COVID-19. It would, in a regular year, be flu season. What do we know about flu season this year?
Well, that's a great question. We've almost forgotten about other respiratory infectious diseases, but it's a good reminder. We are in the throes of flu season. Obligatory reminder: it's not too late to get your flu shot. Indeed, we heard a previous caller ask if you can get your flu shot along with your booster. Yes, you can. Yes, you should. It is not too late. The flu season this year has been muted compared to the 2019 season. In large part, we suspect because of continued mask wearing, continued degrees of distancing, not as many large gatherings. It's a little bit higher than it was last year, but still nothing like what we've seen in prior pre-COVID years. But it's out there, and it's still the midst. In fact, indeed, it's still a bit early in the flu season right now. So we don't know what the rest of the flu season will bring, but we do know that a flu shot will help reduce the chances that you get the flu or land in the hospital with one. That is obviously doubly important this year, as our ICUs and hospitals are chock full. Don't take the risk of needing an ICU bed because it may not be there.
And Dr. Shah, I wanted to just ask you a general question. You know, we're more than a year and a half into this thing, and a lot of people I know have talked about just generally feeling sort of a malaise, feeling kind of run down, just kind of feeling a little raw. And I'm wondering if just a general health question makes us all a little more susceptible, a little more vulnerable than we might have been a year and a half ago.
I think that's a part of it. There have been psychologists and social scientists who have looked closely at the relationship between how we feel as an individual, how we feel as a population, and our susceptibility to other infectious diseases or other diseases in general. And I think it's plausible to me that something of that sort, that unholy synergy, could be unfolding right now with respect to COVID. Some of it is pent-up demand, individuals who have been putting off going to see their doctor or getting that procedure, who are presenting at a much later stage of illness. But a large part of it is just the zeitgeist right now. We're all down. Just when we thought we could pick ourselves back up, COVID has come back and blown us back down again. I don't know how much longer we can all do it. That's the honest truth. I feel it. My team feels it. And every time I ask them to do one more big thing, I know that the fuse that I've got left, the amount of capital that I can go back to them with, gets smaller and smaller each time. I think everyone feels that way, but it's not without hope. We are among the more vaccinated states in the country. And to the extent that Omicron is a concern, if it becomes a threat, Maine is in a better position to weather that relative to other states. That's a good thing. And it's because of the hard work we've done. My ask right now is that we all just make sure we get those shots and get those boosters.
I'm going to go to Jay, who's calling from Berwick. Hi, Jay. Go ahead.
Hi, thank you for taking my call. Dr. Shah, I just wanted to ask two really quick questions. And that is one, that over the last year and a half, such a huge part of your message is staying inside. We got to stay inside. We're never going to beat this thing. We got to stay inside. But I hear you say all the time now, as the weather gets cooler, we'll spend more time inside, increasing the danger of spreading the virus. So how do you square those two statements? And the other question that I have is, I personally only know 8 people in my life that have tested positive for COVID-19, and every single one of the 8 was fully double vaccinated. What's going on there? I know we have breakthrough cases. I understand that, but what's going on with that?
Yep.
Thank you.
Sure thing, Jay. I mean, let me start with your first question, because Jay, I'd like to respectfully disagree with you just a little bit. My message very early on was stay indoors, let's just figure this thing out. But once it became clear that the risk of transmission is significantly lower outside than indoors, based on a study that a bunch of Japanese researchers did, my message actually has been the opposite. It's not to stay inside, it's to get outside. Outside's safer from a COVID perspective. It's certainly healthier from an exercise perspective. And frankly, it's just happier from a mental health perspective. So my advice has been to get out there. That's what my family and I have done. We've not been shy about being outside, cycling, jogging, hiking, whatever we can find to do. I continue that advice as we go into the winter months. Indeed, great time to be outside is outside enjoying the snow and everything that Maine has to offer. So my advice is not to be inside, it is to be outside. But there's only a limit to how far people will take that. Indeed, at some point, you gotta come in from the cold. That's when the risk arises. And when you do that, when you come off the slopes and you come in from the ice fishing, that's when I'm asking folks to be more careful. It sounds weird to be wearing a mask if you're indoors with your friends, but it's not out of the question if one of your friends has asthma and another has an organ transplant or COPD. It may be needed this winter, especially with more transmissible variants. But Jay, your second question is one I hear a lot because people see it. They see that when a lot of vaccinated folks are the ones that are getting COVID. Jay, I'd ask you to keep in mind as you're looking around that we're in a state that's amongst the most vaccinated in the country. Over 70% of people, 7 in 10 people you meet on the street are fully vaccinated. What that means is that the overall rate of COVID, of vaccination is so high that if someone's going to get COVID by a breakthrough case, it's not a surprise that it occurs in someone who's fully vaccinated rather than someone who's unvaccinated, because there's just a lot more vaccinated folks out there. But Jay, the real question to ask is, what's the relative risk? Where are you more at risk, if you're vaccinated or if you're unvaccinated? And there, data set after data set, including those in Maine, say that your risk of getting COVID if you're unvaccinated is around 1 in 100. But if you're vaccinated, it's much, much, much lower.
We have an email here from Dave. We're all familiar with COVID-19 prevention, but what about treatments? Is there any ongoing research?
There's an immense amount of research on different treatments for COVID-19. Indeed, I think we've all heard about some exciting products that may be coming down the pipeline from Merck, as well as another one from Pfizer. Both of those are oral therapies as opposed to drugs that need to be injected or infused. The one from Merck, although the initial data were encouraging, its luster has dulled a little bit, but we anticipate that it will be coming our way maybe this month or next month, and then the one from Pfizer early next year. Those will be helpful because folks won't, again, need an injection or an IV. But although therapies, treatments are important, there is not a single infectious disease, or indeed any disease known to man, where we would prefer to treat it rather than prevent it. Prevention for every single disease or condition we know is still the preferred path, and we can prevent COVID largely through getting vaccinated.
Dr. Shah, just now on the Associated Press, a tweet that the U.S. is expanding COVID-19 boosters, opening a third dose of Pfizer's vaccine to people as young as age 16. The U.S. and many other nations already urge adults to get a booster. So this is a direct response to one of the questions earlier in the program.
Well, during the break, I tweeted at the FDA to ask them to accelerate it, and I think we're seeing the effects of that. But this is great news. First of all, it squarely answers a question that I've seen and that we've received today, Jennifer. It means that in the near future, we have to study this and make sure we can implement it. So it's not something that you can likely get today, but once we alert providers to this change and make sure they're equipped, it now means that 16 and 17-year-olds, 6 months after their second shot, can now get a booster. This is welcome news. And again, we have to study it before it can be fully implemented, but this is a major step in that direction.
All right, we'll go to Jeff calling from Wiscasset. Hi, Jeff, go ahead.
Yeah, Dr. Shah, thank you for taking the call. And I wanted to know if any effort has been put into understanding natural immunity. It's been estimated by CDC that I think 47% of the people in the United States by May had COVID. I know myself, my family had COVID before it was cool in February 2020, verified by some antibody testing, still strong after all these months. And you mentioned earlier that immunity is the way to that a disease ends in terms of its outbreak in an area. And you also said that you are still susceptible to getting the disease and transmitting it if you have the vaccine. So it seems to me that natural immunity is the only way out of it. And I know there's over 100 studies showing that natural immunity is robust, complete, durable.
So Jeff, what you're trying to ask is what we know about natural immunity and how long it lasts?
Yep. And Jeff, you know, no one doubts that.
So we have lots of questions and not a lot of time. So I'm going to let Dr. Shah respond. Go ahead.
Sure. No one doubts that immunity that's derived from having been infected with COVID is a thing. It certainly is. The question is, how robust is it and how durable is it? How long will it last? And there, the data suggests that natural immunity or virally derived immunity are effective, but they don't stack up quite as well as getting vaccinated. Thankfully, some of the same data sets suggest that the gold standard is both having had COVID and then getting vaccinated. So for optimum protection, I would recommend that anyone who previously had COVID separately and subsequently go out and get vaccinated. Natural immunity is certainly a phenomenon such as it is, but we don't know yet how it stacks up in the long term. We do know that getting vaccinated on top of having had COVID really affords you some of the best protection.
All right, Jeff, thanks for your question. We'll go to Millie calling from North Berwick. Hi, Millie, go ahead.
Hi, everyone. So I had just been listening and I heard Dr. Shah talking about how the best way to really get the most out of prevention and keeping everyone safe is to do the antigen test before you go out, you know, to, like that woman had said, to her concert or out to dinner with family. And so I hopped on my computer to buy some of those antigen tests. And I started reading something, the interim guidance for antigen tests from the CDC. And they said, despite the high specificity of antigen tests, false positives will occur, especially when used in communities where the prevalence of infection is low. So coming from a family of 5 and the antigen tests are about $20 for a pack of 2, that's a lot of money, you know, out the door to test everyone and then test them repeatedly for a test that gives false positives. So I'm just wondering how to go about that when it gives a false positive, as opposed to, you know, like saying that we can't go and hang out with our friends or go to an event because it's a false positive versus it actually not being positive.
Yep. So in an area where there is very low prevalence, what is called the positive predictive value, I won't go too into the details, can drop. Maine is not in that situation. Maine is in a situation of extremely high prevalence of disease. Does that mean there can't be false positives? No, that is a risk. Every single diagnostic test that's ever been developed, unfortunately, runs a risk of false positives and false negatives. Antigen tests are no different. The question is, on balance, given all of those factors, is it better to test and run a small risk of a false positive rather than not testing and run the risk of getting infected or infecting someone at the gathering? Based on everything that I've seen and the data that we've seen, taking the test before you go to the gathering is definitely worth it.
Millie, thanks for your question. I'm going to go to this email from Edward, and we are really tight on time, but I like this. I'm a recently retired physician who is still licensed and insured. I was inspired to call my local Walgreens and just spoke to the pharmacist who confirmed they have staffing issues. Apparently, only the pharmacists are giving the vaccines. He told me to go up the chain of decision making to see if Walgreens would like me to help out giving the vaccines. I will gladly volunteer. Perhaps your other listeners who can also help in a similar way might be able to do the same. Thanks. I've been wondering what else I could do besides our hospital vaccine clinic. So we have about 45 seconds left, Dr. Shah. You have any other suggestions?
Yes, I do indeed. Edward, thank you for pursuing that. That's certainly an option, but let's say that doesn't pan out for whatever set of reasons. Fear not, because there are almost certainly vaccine clinics in your area that are run by hospitals, or the one that the Maine CDC, MEMA, and the Guard are running here at the Armory in Augusta. We'd love to have you and others as a volunteer. If you go to Maine Responds, which is our volunteer management system, you can register to serve as a volunteer, as a vaccinator, a greeter, an observer. We'd love to have you on board.
All right. And then Terrence here on email, he wants you to open more clinics, Dr. Shah. He wants them all over the state. I'm sure he's not the first person to tell you that.
No doubt, but we're starting with the one in Augusta, and I'm pleased to see that in 2 days, we've done well over 1,200 shots.
Thank you so much for joining us here today, Dr. Nirav Shah, Director of Maine Center for Disease Control and Prevention. Today's sound engineer, KG Akimaladun. We had help from Nick Woodward, Nick Godfrey, and Andrew Catalina. Maine Calling is produced by Jonathan Smith and Cindy Hahn. Tomorrow on the program, we listen back to our popular show, The Made in Maine Gift Guide. I'm Jennifer Rooks, and you are listening to Maine Calling on Maine Public Radio.